So hi everyone, I'm Ruth. I'm a consultant at North Manchester. I grew up in Rochdale, so it's lovely to be back here. And thank you so much for inviting me to come and talk to you about respiratory viruses. So Steve just mentioned that Chris and the rest of the long COVID team are going to be talking after me, so thank you so much for coming, guys. I really, really appreciate it. And we've also got two doctors in the room, so Dr. Muller and Dr. Khan over here, who are here to help and talk to you and help to translate. So if there's anything that you don't understand that I'm talking about, I'm sorry, my Urdu is terrible. So please, they will hopefully be able to help explain a little bit to you. So if you want to ask any medical questions, please ask me, or you can ask one of them. Are you going to be next slide, please? Oh gosh, right, it's like Chris Whitty. So I wanted to kind of try and think about what you guys might want to learn from this event. So really just to talk about what types of infections cause respiratory kind of viral infections, what is a virus, how do you get a virus, who is at risk of viral infections, what kind of symptoms do you get if you have a virus, and what happens, can it be a serious thing? What do you need to do if you have a viral infection, and how can you protect yourself from viral infections? And then, as we've already said, we're going to talk a little bit about long COVID, what the definition is of long COVID, and what you can do if you do have symptoms of long COVID, and how we might be able to help you. So, infections. So, infections are caused by germs, and germs are can be lots of different things. So there are lots of different things that are germs. So bacteria are germs, viruses are germs, fungi are germs, parasites, things like ticks or mosquitoes or worms, those would all be counted as germs. And there are millions of germs, and we encounter germs all the time. Not all germs are bad. Germs live on our bodies, they live inside our bodies, and they don't always cause us to become unwell. But when a germ enters the body and it multiplies and it causes a reaction in your body, that's what we call an infection, and that's when we can become more unwell. Thanks, Chris. So viruses. So viruses are a type of germ, and viruses infect a living thing, so that thing is called a host, and they can't replicate on their own viruses, so they have to infect something, which is called a host, and then they have to turn their cells over, use that host cell to make more viruses. So they hijack the normal things in our cells, the bits of our cells that we use to repair our own cells. They hijack that normal machinery and they use it to make more viruses. So when a virus infects a cell, it hijacks your normal cell machinery, and eventually the viruses will break out of the cell and they will kill that cell. That's something called lysis. And when that happens, that means more virus can spill out into your body, it can cause more of an infection, but it also causes a reaction in your body, and things like little proteins and chemicals and things are released, and that can cause problems. So the other thing about viruses, which is very specific, is that when a virus invades a cell and it uses the cell machinery to make more virus, it does that very quickly. And when it does it very quickly, there can be faults in how that virus does that. So the virus might have a different spelling in the sentence of its DNA. And that can cause the virus to change. So viruses change very, very frequently and very, very quickly. That's a process called mutation. So that's something that's very particular to viruses. Another thing that's very important to know about viruses is they are not the same as bacteria. So they work in a different way. So antibiotic medicines that you might ask for or think that you need or take for an infection will not work against a viral infection. So antibiotics do not work for viruses. Okay. So the common winter viruses, so the things that I'm mainly going to talk to you about today, are these three things. So there's a virus called COVID, also called coronavirus, or COVID-19, that you've probably all heard of. There's a virus called flu, which is also called influenza. And then there's another virus which I'm just going to mention, which is called respiratory syncytial virus. So those three viruses are all very common in winter, and they cause a lot of winter infections. They're all respiratory viruses, generally, so they tend to cause problems in the airways, in your nose, in your throat, in your eyes, might cause some headaches and kind of flu-y symptoms, muscle aches and things like that, or you might get more of a chest problem, so a cough or breathlessness or wheeziness. There are other common infections in the wintertime, so things like norovirus, that's not a very nice infection, which causes diarrhea and vomiting, and lots of infections tend to be common in the wintertime, but I'm just going to talk really about those three. So there's a very short video here which just says about how you catch a virus. Well, you'll have to open YouTube because it wasn't working before. So I'm just going to see if this works. So this video is just a quick video of explaining how viruses get caught.
When we breathe, talk, laugh, cough, or sneeze, we release droplets into the air. Some of these are microscopic and can remain floating in the air for an hour or more. Others are large, fly through the air briefly, and fall to the ground or other surfaces within seconds. If a person is infected with the virus, some of the droplets may contain viruses. The droplets also contain large amounts of salts and proteins and other chemicals that are in respiratory fluid. If the air is not very humid, some or all of the water in the droplet will evaporate, leaving behind a smaller droplet that is about half the original size. From research on flu patients, we know that at least half of the viruses that are expelled into airborne droplets are found in those smaller than 5 microns, which can remain floating in air for half an hour or more. During this period, they may be carried by air currents many meters from the person who released them. But this process also dilutes them in the air, reducing the chance that you could breathe in a lot of them. Viruses and droplets that land on surfaces and in the microscopic ones that float in air break down over time and lose their ability to cause infections. How fast this happens depends on the type of virus and conditions such as temperature, humidity, and the type of surface material, whether it's cloth, paper, plastic, or metal. There are a lot of things we still don't know about viruses in the air. We don't know how much transmission occurs through inhalation of such viruses versus them landing in our eyes, nostrils, or mouth, versus touching them on objects. For most types of viruses, we don't know how many are found in different size droplets and how well the viruses survive under different conditions in the real world. What is clear is that for some types of respiratory viruses, transmission at close range can occur through multiple routes, including direct spray of large droplets onto the body and inhalation of microscopic droplets.
So, hopefully that clarifies a little bit how we get viruses. Although I think it's fair to say that we probably don't know a lot still about how viruses are transmitted. Oh, YouTube's still on. And a lot of the kind of controversies around viruses in COVID were related to not understanding a lot about how viruses are transmitted. So, thanks Chris, sorry. Coming back to the middle. You might have to skip again, thank you. So, who is at risk from winter viruses? So we've talked about some of the common things. Now it's important to know who is at risk of getting these illnesses. So I think it's fair to say that anybody can get a virus, and we all have viruses, and it's very, very common for us to get viral infections. And especially if you live with small children or you have a lot of contact with small children, you will know that you will be frequently getting kind of things like colds and sniffles and sore throats. But there are some groups of people who are at a higher risk of becoming more unwell with viruses. So there are some things that are physical factors that mean that we're at higher risk of viruses. So that's people who are very young, so under the age of 5 or older, over the age of 65. People who have other health problems, in particular people who have lung problems like COPD and asthma, people who have heart problems like you might have had a heart attack or have heart failure, if you've ever had a stroke, if you have diabetes. Pregnant women are at risk of viral infections too. People who have cognitive impairment, people who have reduced mobility or are not as mobile or who have a history of falling. So those are the physical things that might increase your risk of having viral infections. But there are also some things in our environment that might increase your risk of getting a virus, of becoming more unwell with a virus. So if your home is cold or if it's damp, if you don't have enough heating, if you don't have anywhere to live or you sleep outside, if you have a poor diet, if you smoke or you live in a house with somebody who smokes, and some people who work in certain jobs are at risk of viral infections. So if you work in healthcare or social care, or if you work in another job, like you're a teacher, or you work in a job where you're encountering a lot of people in a confined space, we tend to see a higher risk of viral infections. And from South Asian communities, we know that there are a lot of people in the community who have things like health problems that might predispose them, make them have a higher risk of becoming more unwell with a virus like flu or COVID. Thanks, Chris. So what symptoms do viruses cause? We've talked a little bit about this already. You will have all had viruses, so you'll know that the common things are things like itchy eyes or a runny nose or a sore throat. You might feel a bit tired or a bit run down. Some people might have a cough, you might have a temperature, you might have a headache. But if you've ever had a really bad flu or COVID, really serious COVID, then you might have a very high temperature. You might have sickness, you might not be able to eat, you might lose weight, you might have muscle aches or feel extremely fatigued, feel very, very tired. And these symptoms can go on for several days, even weeks. With COVID, there are some specific symptoms, and I'm sure the long COVID team might talk about them in a bit more detail, but there are some things that we know with COVID, like you might have lost your sense of taste or smell if you've ever had COVID. So can viral infections be serious? So I think most viral infections are very mild, and most people get better without any treatment at all. But for some people, they can become very unwell with viral infections, and sometimes viruses can cause a condition called pneumonia. So pneumonia means we can see a patch of infection on an X-ray. That's what a pneumonia means. So if you become very unwell with the viruses, then you might need to come to hospital. Sometimes if you're very unwell, people need to be supported with breathing. They might need a ventilator in intensive care. and sometimes people can die from viral infections. And one of the reasons that we worry about viruses is because they're so common that even though most people get better with viruses, because they are so common, the number of people who come to hospital with viral infections is still quite high. So the other thing to say about COVID is that we know that some people who have COVID may have symptoms for many, many months after they become unwell with their COVID infection. So that's another potentially serious thing that can happen to people after they've had a virus. At the moment, about 3% of people in the whole of the population of England and Scotland have COVID. About 10% of people in the whole of the population have flu, and about 5% have this other virus called RSV. So that's quite a lot of people. So that means that you're likely to have contact with people who have these infections. So how has COVID impacted South Asian communities in the UK? I think it's important to say that the pandemic didn't affect all parts of the population equally, and we know that people who are from South Asian communities had more infections, they were more likely to become unwell, and they were more likely to die, unfortunately, of COVID. And you may well have had friends or relatives who died because of COVID. And there are lots of reasons for this. There are some reasons, like I've explained, because of the risks of becoming unwell with a virus. There are some reasons about living with lots of people in a house that would increase your risk of getting the virus, the types of work that people do, and also access to healthcare, vaccination, and kind of other reasons why people may not have received equal treatment who are from a South Asian background. And there are other things that have impacted the community disproportionately in a different way than other ethnic groups in the UK. So there is evidence to say that people's mental health, if you're from a South Asian community, might have been made worse by COVID, and also things like physical health. So through not being able to speak to your doctor, or not having regular checkups, or having to wait a long time to be seen, and other things like that. So what should you do if you become unwell with a virus? So my dad has helpfully managed to fix these, which I bought off Amazon today. So I'm going to give you them and pass them around. So this is an oxygen meter. So you can put this on your finger and check what your oxygen levels are. You just press the button here and it tells you what your oxygen levels are. So it should be something between 94 and or above. Anything above 94 is okay. So we sometimes use these to decide how poorly somebody is, and I'm sure Chris remembers that when we were discharging people from the hospital with COVID, we used to give people these and see how their oxygen levels were. So I've said this a number of times, but most people who have a virus have mild symptoms. So if you've just got a bit of a cough or a headache or a low temperature, then we would suggest that you take lots of fluid, so at least 6 to 8 glasses of water a day. You can use normal pain medicines like paracetamol or ibuprofen for your temperature. If you are in an at-risk group for COVID, then we would, the advice is still that you should do a test, a COVID test, and then you can speak to your GP or phone 119, which is the vaccine helpline, because you might be able to access some treatment for COVID. So there are some very particular treatments, not antibiotics, but a bit like that for COVID. And there are also treatments for influenza, which, again, if you are in an at-risk group, you would be able to get. So if you're in one of those groups that I was telling you about before, you've got health conditions, you're over the age of 65, you're pregnant, we would usually suggest that you speak to a healthcare professional, even if you've only got mild symptoms, because you might be able to get some treatment. If you were getting worse, so your symptoms had not been getting better, they were going on for days and days, you're coughing up phlegm, you've got a higher temperature, you can't eat and drink, it's really important to make sure that somebody's checking up on you if you live on your own, or if you know somebody's in this position and they live on their own, just to check up on them. You can speak to your pharmacist and they might be able to help with some other medicines, and also you could make an appointment with your GP. But if you're becoming a lot more unwell, so you're very breathless even when you're resting, you're finding it difficult to take a deep breath in, you've got chest pain, if you're cold, you're clammy, your skin is changing a different colour, your lips or your face are blue, if anybody is then they're not behaving normally, so their behaviour has changed, or they're more sleepy than usual, that is an emergency, and we would always suggest that you speak to a healthcare professional as an emergency. So call 111 or call 999 or come to A&E, because you could have a very serious viral infection. So what can we do to protect against viruses? So I'm so glad they've put these posters up at the back. So Deeplish Community Centre is a warm space, so there are spaces within Rochdale that you can go to, where community spaces where you can keep warm, you can have a cup of tea, you can seek advice about heating and about bills, energy bills and things like that. So that is really, really important, and I would really encourage you to speak to the people from the centre if you're worried about anything like that. Making sure that you're drinking enough fluid. Carry on staying active if you can, and even if that's just up and about, making a cup of tea or going upstairs to the toilet, that's really, that all little bits are helpful. And if you can, or anybody in your house smokes, then stop smoking, because we know that that can increase your risk of getting a virus. To try and reduce the spread of viruses, you can wash your hands regularly, cover your face if you're coughing or sneezing, and if you know somebody is at risk of becoming unwell with a virus, then, and you have a virus, you can maybe try and avoid seeing them, if you can, for a few days until you're feeling better. And you can prepare to have viruses, because you know that it's very common, so you can have simple medicines in your medicines cabinet and make sure that all of your medicines that you're supposed to take from your pharmacist are all up to date. But probably the main thing that you can do to reduce the risk of becoming unwell with a virus is to have a vaccine. So we're just going to talk very briefly about that. There's a super quick video again about vaccines. Thanks, Chris.
The COVID-19 vaccines work just like any other vaccine you may have had. Vaccines train our immune system to make antibodies and cells to fight the infection. The vaccine does not contain COVID-19 and cannot give you the virus. The vaccines do not contain anything that has come from fetuses or animals. The vaccine does contain a minimal amount of ethanol, but less than you would find in a banana or slice of bread. So they are suitable for those who wish to avoid consuming animal products or alcohol because of religious, cultural, or dietary reasons. More and more religious leaders and organizations are encouraging people of faith to get the vaccine. You can find the list of ingredients in the approved vaccine on the NHI website. For the facts on the hashtag COVID vaccine, visit www.nhs.uk/coronavirus.
So that's a bit of specific information about the COVID vaccine. But in general, the principle is the same. Vaccines often contain bits of the virus, or bits of the virus that we're trying to vaccinate against. And when they are put in your body, they create a response in your body, an immune response. And that means that if you then get exposed to the virus in real life, your body already has some memory of that virus, so it's better able to fight the virus off. So, should you get a COVID or a flu vaccine? So these are the people who are currently recommended to get a vaccine for COVID and flu. And you'll notice that it's a lot of the same people who are at risk of becoming seriously unwell with these viruses. So if you're over the age of 65, if you've got a health problem, if you're pregnant, if you work in a high-risk job like you work in health or social care, if you're a carer, if you live in a care home, or if you are somebody who has an underactive immune system, or you live with somebody who has an underactive immune system. So if you fall into any one of these categories, then we would recommend that you get a vaccine for COVID and for flu. Children are also eligible for the flu vaccine as well. So all school-age children from reception to year 11 are offered a flu vaccine. Children aged 2 to 3 are also offered a flu vaccine. And then there are other children who are slightly outside of those age ranges, if they have certain health conditions, who are also offered a flu vaccine. So there are slightly different rules for children and flu vaccines, but they should all, hopefully, if you have children or grandchildren, have been offered a flu vaccine through school. Thanks, Chris. So, is the vaccine going to make you unwell? So it's quite common to feel a bit poorly after you've had a vaccine. So common symptoms to get after you've had a vaccine are you feel a sore arm where the needle goes into your arm. You can feel some of the symptoms of the virus. So you might feel a bit tired or have a headache or have achy muscles or feel a bit fluey, have a bit of a temperature or feel a bit sick. But very serious side effects are very rare. So probably the most common serious side effect for the COVID vaccine is something called anaphylaxis or an allergic reaction. And that is definitely seen, but that's very, very rare, less than 1 in a million people. And there have been some other very rare reports of things like inflammation in the heart muscle, which can happen after the COVID vaccine. But again, those side effects are extremely rare, and millions of people have had these vaccines safely. Are there concerns around the vaccine? So some of the things that you might hear of are that the vaccine doesn't work. So vaccines don't stop you from getting an infection, a viral infection. So if you have a COVID vaccine, you can still get COVID. I mentioned earlier on that the viruses change very frequently because they are constantly replicating in your cells, so they can do this thing called mutate. And that means that the vaccines have to change as well, because the virus is constantly changing. So because of that, sometimes the vaccines are not 100% perfect for that virus. But the main thing to say really is that the vaccines reduce the risk of you becoming very seriously unwell. So certainly in my job, I don't see people coming to hospital with very severe COVID anymore, anywhere near as much as we used to, and that's because of the vaccine. So there's other things that people have said to me about worries about the vaccine. So there wasn't enough research done about the vaccine before it was rolled out. And it is, obviously the vaccines were developed especially for COVID very, very quickly in a year. And that's very rare, that's never really happened before. But because everybody around the world was trying to create a vaccine for COVID, there was a real community effort trying to kind of pulled together to create this vaccine to help people. And the vaccines went through all of the same processes of checking and safety that any other medicine or drug would have to. And there were other things that people have said to me about the vaccine, worrying about the vaccine changing your monthly cycle, so if you're a woman. So there is something about COVID that maybe does and can do that. It can affect your monthly cycle, but we don't really know why or how. Certainly, I don't know if you guys see this very much in the long COVID team, but there's been issues around the menopause and COVID inducing menopause in women. So if this is a problem for you, and it's quite a common problem, then we would really suggest that you speak to your GP about it, because there are treatments if you are having symptoms related to the menopause, so things like sweats or dryness or changes in your mood, that we can treat, and we can give you hormones to treat that, and it's something that's not really discussed very much, so we would really encourage you to speak to your GP about it if you want to. So, how can you get a vaccine? This is my last slide. So you can speak to your local pharmacist. So they're the best people probably to speak to. And the local pharmacist in Deeplish, I think, do vaccine clinics, and they can either arrange for you to have a vaccine or they can refer you for a vaccine. You can speak to your GP. There's a phone number called 119, which is the vaccines helpline, which you can ring, but I don't know if anybody will answer. And you can go to a walk-in vaccination clinic. So there's the Gateway team. This is based across the whole of Greater Manchester. There's a phone number there, so you can have that afterwards if you're interested in getting a vaccine, or you can go to a walk-in clinic. I don't think there's one in Rochdale in the next week. I didn't check, but there's some in Manchester. But you should be able to get one through your GP or your local pharmacist. So.